I like to start the presentation with a slide that usually my boss, my chief, Dr. Rodriguez Antolin, used. Is the original article by Hugin and Hughes about the importance of testosterone related with prostate cancer and demonstrate how in patients with metastatic prostate cancer with blockading the testosterone we can have a better prognosis. But move on to our topic. I had to talk about lower urinary tract symptom, usually before surgery, and testosterone deficiency. In this slide, I saw how testosterone affect the lower urinary tract symptom at the connection between both. You can see testosterone is related with a metabolic syndrome, and also the testosterone deficiency affect the inflammatory status with many markers to increase, and all of them can be related with urinary tract symptoms. So this inflammatory status, the metabolic syndrome, all of them can be related with a worsening in lower urinary tract symptoms. In this slide is another article that we can see that is quite similar, the mechanism why testosterone and lower urinary tract symptoms can be related. So the first question that I want to ask is in patients with normal level of testosterone, they had an effect in lower urinary tract symptoms and in the development of benign hyperplasia of the prostate. You can see this is a study with patients that are selected to follow the screening of prostate cancer. And you can see that the testosterone level, the first answer, don't affect the site of the prostate. There are similar levels, no differences between those with normal and a large prostate. We also evaluate the symptom using the IPSS score, and there are no differences, and even more, they evaluate the quality of life referral, and there are no differences. So it is seen in patients with normal testosterone level, there is no effect in the lower urinary tract symptom. This is another study, also with a patient with normal testosterone level, and they evaluate not only the site of the prostate, not only the symptom of the patient, also evaluate the urine function, the Q mass, and the residual volume. It is seen that patients with lower level of testosterone can have a worse Q mass and a worse residual volume. But when they stratify for age and the metabolic syndrome, there are no differences. So it's seen that the age has an effect and other things at the metabolic syndrome had an effect. So the first answer is that in patients with normal testosterone level, there is no influence in the symptoms of the patient. I would like to highlight this revision that do give the main answer about testosterone. First of all, the testosterone deficiency and lower urinary tract symptom increasing with age, and I demonstrated in the previous slide. It is important that the prostate gland is not at the root of your urinary symptoms. And there are many patients with underactive bladder, many patients with overactive bladder that we have to be in mind, especially when they are going this patient to the surgery. There is a dissociation between lower urinary tract symptom and the volume of the prostate, and it is important that low serum testosterone, it is seen that is not protected against loss, and we are going to see in my next slide. It's important that men with higher endogenous testosterone level are not in a greater risk of developing prostate cancer. In this article include the main revision in patients with prostate cancer treated with radical prostatectomy, with radiotherapy, and with brachytherapy, demonstrating that it's not in a high danger in patients with a controlled prostate cancer to administer testosterone to this patient. But if we had to speak about patients with lower urinary tract symptom and testosterone deficiency, in this scenario, we can supplement testosterone to this patient. So the first answer in this article, in patient they don't have medication, drug medication for lower urinary tract symptom, demonstrate that testosterone supplementation in this patient don't worse the symptom related with the prostata. What is more, in some cases, it is seen that the symptom improved. They compare the symptom before and after the treatment, and they demonstrate that there are improvement in the symptom in both in steroid and also in the voiding symptom, and there is a better result also in the volume residual of this patient. Another study, they evaluate patients with both no medication and medication for lower urinary tract symptom, and they demonstrate that the treatment of testosterone deficiency did not work the symptom. Even more, it is seen also there is an improvement in the symptom measured in the IPS, the American one, and they stratify between patients with higher PCA over than 4 and those with a lower PCA. The improvement was higher in patients with a higher PCA and also a better result in patients with older age. This is a real study. It's a study comparing patients with testosterone with placebo. The previous study compared patients before the treatment with testosterone and after the treatment, and this is a comparison between the patient. And the important thing in this study, they also evaluate the inflammation. Do you remember in my first slide? The inflammation is also related with testosterone deficiency, and they demonstrate that there are no difference between the PCA and the symptom before and after the treatment with testosterone, but the inflammation parameters improve in this patient. So maybe it's a good thing for the surgery of the prostate. They conclude that it can be good to treat the patient with testosterone deficiency with testosterone, even if we are planning the surgery. And finally, I saw this systematic review about the treatment with testosterone in patients with testosterone deficiency and lower urinary tract symptom, and all the studies conducted even with injected testosterone, with topical testosterone, demonstrate that testosterone can be used in patients with lower urinary tract symptom. It is seen that even the symptom improve, and is not a danger to use the testosterone, the patient. You can see here the result. There are not statistical differences, both in control, in the upper part, and in those with treatment. And this is, I want to include this article by my friend Javier Romero, that it was published 10 years ago, that gives a guide on how to manage the patient. I think that we can currently use the guide. The first thing is to evaluate if the patient had a testosterone deficiency, and according to that, it is possible to treat the testosterone deficiency in this patient, and we can combine with treatment for the lower urinary tract symptom. So finally, to my conclusion, the testosterone replacement therapy can be administered in patients with both lower urinary tract symptom and with no urinary tract symptom. We had the first article by Hugen can be risk for prostate cancer, but it's demonstrated what is safe to use testosterone even in patients with prostate cancer. So there is no increased risk in recurrence of progression, and in men with untreated localized prostate cancer, electing for active surveillance that given by the patient with cancer. Little is known about the potential risk of the testosterone replacement, and in this patient we had to think before to do so. Thank you very much.